Have you ever wondered what diabetic ketoacidosis is? Well, it's high time we delve into this topic. Diabetic ketoacidosis, often shortened to DKA, is a serious complication that can occur in individuals with diabetes. It develops when the body starts to run low on insulin, a hormone that helps us use sugar for energy. In the absence of sufficient insulin, the body begins to break down fat as fuel, which leads to the production of ketones. Ketones are a type of acid that the body can use for energy. However, when produced in large quantities, ketones can cause the blood to become acidic, leading to diabetic ketoacidosis. Imagine your body as an engine and insulin as the oil that keeps it running smoothly. Without enough oil, the engine starts to break down, leading to wear and tear and serious damage over time. That's what happens in our bodies during diabetic ketoacidosis. So diabetic ketoacidosis is quite a serious condition, isn't it? But don't worry, we're going to break it down further. Now you might be thinking, why does diabetic ketoacidosis occur? Well, the answer lies in the role of a hormone called insulin. Insulin's job is to help our cells absorb glucose, a sugar that provides energy for our bodies. But sometimes, in cases of diabetes, there's not enough insulin to go around. So, what happens when there's a shortage of insulin? Here's where things get interesting. With no insulin to help absorb glucose, the body starts looking for other sources of energy. It begins to break down fat as a substitute. This process, however, produces a byproduct, a group of acids known as ketones. Now, a little bit of ketones is okay, but too many can be harmful. They start to build up in the bloodstream, making it more acidic. This is what we call diabetic ketoacidosis. Understanding the why is essential, isn't it? But what about the symptoms? How do you know if you have diabetic ketoacidosis? So, how do you recognize diabetic ketoacidosis? What are the symptoms? Diabetic ketoacidosis, often shortened to DKA, presents a range of symptoms that generally come on quite quickly, often within 24 hours. The first signs you might notice include excessive thirst and frequent urination. As your body tries to flush out excess sugar and ketones, you'll find yourself feeling parched and making frequent trips to the bathroom. Feeling sick to your stomach, nausea and even vomiting are common symptoms too. This is due to your body's response to high blood sugar levels and ketone buildup. But the discomfort doesn't stop there. Another symptom of DKA is abdominal pain. If you're feeling a sharp, persistent ache in your belly, it could be a signal that your body is battling against high blood sugar levels and ketones. Shortness of breath is another sign to look out for. When your body isn't getting enough energy from glucose, it starts burning fat, resulting in a buildup of acids called ketones. This can make your breath smell fruity, another telltale sign of DKA. These symptoms are more than just discomforts. They're warning signs that your body is in distress, and it's crucial to seek medical attention promptly if you're experiencing them. Those are quite a few symptoms to keep in mind, right? But what happens if diabetic ketoacidosis is not treated? So, what happens if diabetic ketoacidosis goes untreated? Well, the implications can be quite severe. Diabetic ketoacidosis, or DKA for short, is not something to be taken lightly. It's a serious condition that, if left untreated, can lead to a slew of health complications, some of which are life-threatening. Imagine a car engine running without oil. It will eventually overheat, causing irreversible damage. Similarly, when your body doesn't have enough insulin to use sugar for energy, it starts breaking down fat, releasing ketones into your bloodstream. This causes your blood to become acidic, hence the name ketoacidosis. If left unchecked, the high level of ketones can lead to complications such as kidney failure. Your kidneys play a crucial role in filtering waste from your blood. If they fail, the waste builds up, causing a chain reaction of health issues. Heart disease is another potential risk. The strain of dealing with high sugar levels and ketones can put your heart under immense pressure, leading to heart disease or worse, a heart attack. In the most severe cases, untreated DKA can lead to coma or even death. But here's the good news. Diabetic ketoacidosis is largely preventable. Effective management of diabetes, including regular monitoring of blood sugar levels and appropriate medication, can help you avoid this health crisis. So, managing your diabetes is key to preventing diabetic ketoacidosis. Remember, knowledge is power, and understanding diabetic ketoacidosis can save lives.